Hi, I'm Dr. Akshay GL from Karwar Institute of Medical Sciences, Karwar, and I secured a rank of 551 in the recently conducted NEET PG 2023. I'm very happy and glad that I got a decent rank, and hopefully I get the branch I like. For me, I started my preparation only after internship. Once I came back from my after internship, once I came back home, I joined DBMCI in the June 20, later half of June, the batch 3. During the classes were very hectic in terms of timing because it was used to go for like almost 10-12 hours. So during classes, I just used to come back home and then relax for some time and try to revise maybe a small part of whatever was done in the classes. And between two classes, there used to be a few days gap. So in that gap, I used to make sure I complete whatever was done during the classes. So yeah, I started my revisions properly only once my classes ended. So we had an INI CET towards the end of our classes. So till then, not even one revision was done. So after that, I started my revision properly in December. So I had a solid 3 months to revise whatever was done in classes. So I'm sure everybody would have told you about how much to study and what to study and how important it is to study. So I wouldn't want to tell a lot about that because it's already known that you have to study and it's a part and parcel of the journey for the NEET preparation. But what I would like to tell is your mental health and your support system should be very strong, especially in this time where it's like a rat race and everybody wants to, go ahead of you, and it's a lot to process in this time. So I would like to tell more about how to keep yourself sane in order for you to study in order to crack the exam. So maybe your parents might help, but the best support system is your parents, no doubt. But they might not understand what you're going through because of maybe they haven't gone through the same or any other factors. So what I would like to tell is your friends from UG are the best people you can, connect to because even they are going through the same thing. So you can support each other and motivate each other and everything. And for me, I used to go to study room to study. So I had a very good support system there. So I would like to thank all of my friends from UG and study room and DBMCI classes and everywhere. So all this is only possible because of you guys. So thanks a lot. And coming to the DBMCI faculty, they are world class apart. So there's nothing more I can tell about them because they're really good. And initially what I felt was after classes when I used to do a few questions, I'm like, many things are missing and maybe I could have, this point is missing, that point is missing, maybe they could have covered more and everything. But once I wrote my INI, I realized that your class notes are more than enough. I actually thought while writing the exam saying that is it that our staff only set the paper because everything is from their notes, most of them is from their notes. So initially when I thought it is not that, it is, we need more, but then no, the notes are more than enough. All you need is repeated revisions. So make sure you do that. And revision wise, I did 3 revisions before the final NEET. So I think that is sufficient. And coming to the frequency of GTs I used to give, initially we were told to give minimum 1 GT irrespective of whether you have studied or not. So that used to happen. And once the revision started, you feel like giving more GTs. You're like, I've studied for the past 2 weeks. So I want to see how much I've studied and whether it's up to date, up to mark and everything. So for that, GTs were very important. So initially once a month, and once you start your revisions and once you finish your first revision, you can start giving once in every 2 weeks. And maybe towards the end, you can give weekly one. And more than giving the GTs, reviewing it is more important because giving GT is a 3 hours work, but reviewing it is a 6 hour work because you have to know what you're right and why you're right or why you're wrong. So, and I would like to thank all the DBMCI staff for making this journey a very smooth journey for me. And in staff, I really liked microbiology Dr. Nasir sir because he in the chaos that is microbiology, he actually found a pattern. He made it easy. He made a subject like micro easy. So it's easy to make an interesting subject, good and very nice. But he made a difficult subject like micro, which is comparatively difficult, where people find it difficult. He made a difficult subject like micro easy. And so I thank everybody who was a part of this journey. And I dedicate this to everybody who supported me and helped me in this time. So thank you, everyone.